Okay, welcome everybody to our February Lunch and Learn. Along with the theme of Valentine's Day, we decided to focus on self-love and self-care because we all know you cannot pour from an empty cup. We serve people every day, whether it's our patients, referral sources, anyone who walks through the door, they're looking for care, for love, for improved health. And if we ourselves do not have that love to give to ourselves, we won't have enough to give to others. So very important topic, not just for therapists, for anyone at Spine and Sport. We're all professionals who assist with patient care. So we want to be the best version of ourselves so that we can help our patients. So I'm excited to introduce Chris Hux. He's a physical therapist, now living in Chicago. He actually did work for Spine and Sport in, I don't know how long it's been anymore, 4 years ago, 5 years ago?
Oh man, let's see, it's been
It was right when we, right before we opened Encinitas Clinic. Chris came on board from Florida, right? University of Central Florida.
correct.
And then Chris and I actually got to open up our Encinitas Clinic together, which was our first venture inside of LA Fitness. So it was very different. I think we both got outside of our comfort zones in different ways throughout that process. So Chris has gained a lot of good experience over the years, different things, different physical therapy, adventures, even travel PT. So you've got a great story. I'm glad to have you back visiting us at Spine and Sport and telling us about the importance of self-care and your journey of how you became a stronger physical therapist.
Absolutely, absolutely. And again, thanks so much for having me. You know, my time with Spine and Sport is a time I will never forget because, you know, it was just a turning point in my own life and everything. So, you know, looking back at, you know, through my career, so I've been practicing now for 6+ years, 6+ years as a physical therapist. Graduated in 2014 at a University of North Florida. So, you know, beginning of my career, it was a lot of just figuring things out. I was trying different settings, you know, really trying to find what part of PT I liked. You know, I like outpatient, inpatient. You know, I know my first job was worked at a skilled nursing facility. So I even started, you know, sometimes say it's at the bottom, just starting at the bottom, you know, just kind of get my feet wet. So yeah, a lot of it at first was figuring things out. And I remember that time prior to Spine and Sport, it was, I had a lot of tough times. You know, I had a lot of challenges with treating patients. You know, I was constantly taking on their negativity, taking on their complaints, not only when I was treating them, but then I'd bring it back home to me. So then, you know, it was not allowing me to do the self-care, do the things I needed to do to, like, kind of like what Sharon said, keep that, you know, we got to keep the cup full, right? We got to keep that cup full. Once it's full, then we can overflow to our patients, to our loved ones, friends, all that good stuff. So, you know, looking at Spine and Sport, and this is a story Sharon and I talked about recently. You know, it was a big turning point because I remember so this was, we just opened up the Encinitas Clinic. We were, like she said, completely outside of my comfort zone. You know, we were learning the whole business side of things on top of the being a physical therapist, trying to give, you know, your best care to every person that came into the door. And I remember voicing to Sharon, I'm like, man, I know you had me take this Strength Finders test. I'm sure all of you guys here have taken the Strength Finders test. But of course, one of my top fives was empathy. I think it was 2 or 3 or something in that list. And, you know, working at Spine and Sport, I was just, again, I was unable to, I felt like I was unable to really help these people because I was, you know, taking on their negativity, taking on different complaints. So I wasn't able to be, you know, the therapist they needed. You know, our patients need us to be 100%. That's how we're going to get them, you know, hitting their goals, you know, getting them out of pain, injury prevention, all that good stuff. So yeah, so I brought this to Sharon. I'm like, oh, I'm struggling here. I'm struggling. And keep in mind, like prior to this, I wasn't able to really ever voice this to anyone. I just didn't feel comfortable. I don't know if it was my ego, being a man. I just didn't want to appear weak in my work and everything. So voiced it to Sharon, like I'm struggling here and I need some help. I'm taking on these patients' negativity. What should I do? And, she just gave me some advice I'll never forget. She's just like, you have to use that empathy as a strength. You have to use it. You have to, one, take care of yourself, but two, use that empathy to benefit these people, feel them, relate to them, see where they're coming from with everything they're telling you. But you have to use that and then bring them up. So it was just it was a turning point. I was going in after that, going into the treatments when I was meeting people for the evaluation, taking care of their care, just with a different mentality. Felt like I was bringing them up, and then it was giving me motivation to get into my workouts, keep those good habits. Do everything I needed to do just to make sure I was coming to the clinic. I like to say 110% each day, and just keeping my mind right. So yeah, self-care is huge for all of us, therapists, CEOs, everyone that works for Spine and Sport, for sure.
How did it affect you, I guess, personally, with other relationships outside of the clinic? I think you became also more open socially and met a special someone during that time.
Yeah, that is correct. So yeah, so during like outside of the clinic, just things started really evolving for me. At that time I gave up alcohol, and different things, and then I was putting myself in making different lifestyle choices. So instead of going to the bar or going to the wherever sports games to get a drink, I was starting to put myself into like running groups. Of course, at the time I got back in the church, so I was making these different changes in my life, and because of that, I was surrounding myself with like-minded people. So just people that were constantly wanting to build me up, wanting to serve me, and then when you're surrounded by people that are just constantly trying to help you out, it almost becomes part of you. Then you just want to pay that forward. People you start coming across the same thing. So that eventually led into meeting the love of my life, Marnell. I think that was, let's see, that would have been my last year at Spine and Sport before I went traveling. So met her and we did long distance for about 6 to 7 months, which was very difficult, but I guess they say you know when you know. So so yeah, so that led to that, and now we're happily in Chicago. And by the way, that's the reason I'm here. So love makes you do crazy things. She's from Chicago. Had to come here to get her parents' blessing. So I'm kind of stuck here for a little bit.
That's a good point that you make, and we will do this a little podcast style, if I can just kind of chirp in with some questions for you. But it's a good point of it's being very intentional of the activities you choose outside of work and the people that you surround yourself with. If you're looking to improve yourself and your well-being and your mindset, it's very important to choose wisely how you spend that time and who influences you and who speaks to you and what they say. So even when you met Marnell, it was around Christmas time, and while everyone else is partying it up, you went to volunteer, right, at a medical event?
Yeah, that's correct. Christmas Day of 2017. So that was the first Christmas I didn't go back home, didn't travel back to Florida to be with the parents. Decided to go to Arizona to spend Christmas with some good friends of mine. And so we got to spend, time together, but also I signed up for a volunteer event. And it's, like you said, it was a medical mission. It's called Pathway to Health. And yeah, and actually, so I've never attempted, I don't know if you guys have ever, not been able to sign up for a volunteer event, but that's how big this thing was. I couldn't even get a spot, but, I ended up, my buddy who's a DO, he had a spot. He was volunteering. He was helping people get out of pain, doing like little minor surgeries. So he called me. This was before I was going to head back to San Diego. He called me. He's like, Chris, I need you to come down here. I need some help with my patients. I need some ice. I need some different numbing agents and whatnot. So this almost felt like a call to duty, call to the battlefield. So ended up going there, and of course they had no information on me. They're like, who's this guy trying to get in here? Is they're treating it like a hospital. You had thousands of people trying to get in here because it was all free services, from surgeries to physical therapy to dental to haircuts. Everything was free. So you had people camping out to get treatment for people that don't have insurance. But I went right to the front of the line. I just felt like it's almost like a call. I had to get in there for some reason, help my buddy and whatnot. So after going through about probably 5-6 people, I finally found the head person of the event. So she let me in, and of course the first person I met was Marnell. She was volunteering at the event, and rest is history. But it was a huge blessing just being at that event. Of course, always love going home for Christmas, but it was something I've never done, and met the love of my life. So yeah.
Wow. So you moved across the country. Gradually, you started making better lifestyle choices, eating healthier, drinking healthier, hanging out with better people. You started running, paying more attention to your workouts, helping give back in the community service events. You met the right people. How has that transformed your life as a physical therapist, your confidence in the way you go about physical therapy and the way that you handle your patients now versus way back when?
So the first thing that came to my mind was the running journey. So looking back at prior to getting to running, and of course I really got into it during my time in Spine and Sport. Sharon knows all about this, but I was the person that I just made every excuse. I was thinking, oh, running, I can't run. I don't have the body type. Oh, it's not good for you. So I was saying all this stuff.
The altitude, right, Chris?
Yeah, exactly.
The altitude between Florida and Encinitas, we were like 10 feet above sea level. It's rough.
I was suffering. Oh, going up that 0.5% elevation. I was making every complaint in the books when Sharon and I ran together. But yeah, I was making every excuse, and then of course, having the PT brain, I was starting to diagnose myself. Oh, that's Achilles tendonitis, or that's oh, am I hurting my meniscus? All these things. But but eventually, Sharon did get me to a running group. And keep in mind, this was just so outside my comfort zone, very uncomfortable doing that, and then getting to the point like trying to run 1 mile, 2 miles, eventually 3 miles, and progressive from there. But as I was going through that, all those struggles, those battles, doing more miles, doing something that's I just thought I would never do, stepping out of my comfort zone. I noticed that just started to pour in other areas of my life. It started to pour into my career, doing doing travel therapy, taking more chances. Now I'm in business. I'm physical therapist, and now I'm even a run coach, which is crazy to say from just all the different things I said about running prior. So yeah, I just created this just always wanting to step out of your comfort zone, trying new things. I always share with people, is like one of my favorite quotes: get comfortable being uncomfortable. So yeah, just with that running journey and everything, that's what my life, I've just been trying to do that ever since, trying to take chances and whatnot.
Awesome. And now you have your own business.
Yeah, that's correct. That is correct. I opened up my own business back at end of 2019 after doing some traveling with Marnell. She's a nurse, so travel nurse, travel PT, so we traveled a little bit, but we're like, we need to get some roots down. We have to, I didn't think it would be Chicago. Let's get some roots down. And yeah, so once we did that, I opened up my business into 2019, and it's been a journey, just like running, just like everything, but I'm learning a lot and just being able to serve people every day with it. So
nice. How do you think it's helped your communication or education to your patients? Now you seem to be practicing what you preach. Does that help you communicate more confidently, or what advice would you give to our therapists and other staff when they're communicating or educating patients on helping themselves?
Yeah. So what I would say is it really helps you to go into their shoes. So, when you have someone come in for an evaluation, being able to go through these different challenges, whether it's going through injuries, going through these mental setbacks, like we know a lot of our patients have anxiety, depression, just so many different mental disorders. I always say our field's like 90 to 95% mental, psychological. So since I was able to go through those different challenges of put the self-care, getting running in my life, going through business, of course, a lot of my patients are busy professionals, are business owners. So being able to just relate with them when we're going through their history, they might be coming to me for maybe some knee pain or shoulder pain or whatever it is, but really being able to get deeper on those mental challenges, being able to relate with them on different aspects of their life makes the whole treatment just that much better. I feel like it becomes just a win-win for both parties. You're serving them, but then also you're getting value as you're treating them, going through that journey. So yeah, I feel like since I've gone into business, yeah, I've just been able to get just some awesome outcomes and just really bring a lot of value to people and everything.
Awesome. I guess I'll ask one more question. Meanwhile, I will open it up for Q&A in a couple minutes. And if you want to use the chat to type your questions, then we can answer those as well. But Chris, I think all of us complain about, I don't know whether it's an excuse or a fact, but time is limited. Mm-hmm. So if somebody feels they just don't have the time, what would you say to those people?
I think the biggest thing with that is, I think of people that, this is myself included, that will say, oh, I want to be a morning person. I want to be a morning person. I want to get my workouts in the morning. and everything. And I think it's true for some people. I think some people are just naturally morning people, but I think the biggest thing with time is you got to figure out what works for you, what works with your rhythm. Like whenever I've tried to develop good habits in my life and almost tried to force them, they never stick. So just thought of a book, Atomic Habits. I don't know if you guys have heard of that, but Atomic Habits by James Clear. We have to make the habits easy. We have to make them obvious. So when it comes to your time, look at your schedule. What works for you? Is it morning? Is it, I know we had one PT in Spine and Sport that always worked out during lunch. I think it was Norma. Is it during lunchtime? Is in the evening? So just figuring out like what works for you, and then just showing up. I think that's the biggest thing. So a lot of times people want to go on these marathons, do this 30, 60-minute workouts and try to keep that going for the first 2 weeks. And maybe they get through the first week, but it's almost too much to start with. So I always say, just show up. Even if you show up to your workout for 5 minutes, like literally put a timer on your phone for 5 minutes and just show up, just do it. And then you can, check it off your list. You showed up, you did it. And that will eventually lead to that 20 minutes, to that 30 minutes, to an hour. So that's what I would say. We just got to show up when we're developing good habits.
That's good advice. Start simple, commit to showing up. Chances are in 5 minutes, you'll feel better about it and keep going.
Exactly.
And I think Norma works out before work, during lunch, and after work, but we can all strive to be her.
Yeah. We all need Norma's time.
Yeah. But you didn't have necessarily time, but you chose to make sacrifices. You chose to make your lifestyle different so you could fit in those healthy choices.
Exactly. And it's like you said, it takes time. It takes time to make these changes. And as you are, you just have to remember to give yourself grace. If you do slip up a day, don't put a bunch of shame, bunch of guilt on yourself. That's just going to weigh you down more. So we just have to remember just to be easy on ourselves. We have to take care of ourselves. What's that quote? If you would never befriend yourself, we're just, how we talk to ourselves is just crazy. So we just got to remember to be easy, give ourselves grace every day.
Awesome. Well, if anyone wants to unmute themselves and ask a question, you are welcome to do so at this time, or use the chat.
Oh, it's Dr. Berna. What's going on?
How you doing? Sorry, I chimed in late. I was in another meeting, but I just wanted to say hi. Glad to see you, man. Glad you're doing well.
Yeah, likewise.
Thanks for doing this for us today. We appreciate it.
Of course. Anytime.
It's an important topic that we push to the side. I think that's just the nature of some of us sometimes, is we take care of people every day that we forget to take care of ourselves, or we put it second. We think we have to put other people's care first, but if we're not taking care of ourselves, we have nothing left to give to other people. So just as Chris turned his strengths into a real powerhouse strength of using his empathy to, yes, feel for other patients and have that compassion, but how can you use that to benefit their life, their health, their mindset? Don't soak up their emotions of the chronic pain, the sadness, the depression, the anxiety, and take that home with you, because you'll return to work not ready in the mindset to help other people. So compassion over empathy, I like to say. Acknowledge, of course, always. We always feel for our patients, but how can you use that to make their life better and not just feed into it. They probably have enough people like that in their lives of, I'm so sorry, be careful, don't go to work, don't get out of bed. They need us to be strong for them to really improve their quality of life. So thank you so much, Chris, for sharing that with us.
Yeah,
Absolutely.
thank you for doing this. Very inspiring just to hear literally how, you know, the little habits, radical in the routine of making those small changes to really help benefit yourself so that you can benefit others, especially when we always talk about, you know, we're seeing people in pain that are sad every single day. And so finding those atomic habits to create the overflow of your cup so that you can be infectious to those people, create that trust, that accountability to give hard truth with a kind heart. And I think that's also what you do, and that's inspiring. So this was encouraging for me as well. So thank you for that.
Thanks for sharing. Yeah, we just gotta be 1% better each day. 1% better. We don't have to be 50% better, 100% better. Just try to be 1% better today than yesterday, and then it'll build up over time. Compound interest.
Love it. All right. Thank you, Chris, so much. Bravo. Glad to see you. Glad you're doing well.
Oh, Chris. Good to see
Hey,
you.
hey, thank you. It's so good to see you too, Mark. Is your dad doing well, by the way, Marty?
Yeah, he's not as well as when you were here, but he's still doing okay. But yeah. Hey, sorry to run, but we got to jump into another meeting here. But
Yeah.
congrats on
Yeah,
the wife.
appreciate
Good.
Thank you. Thank you.
All right. Thanks, everyone. If you want to contact Chris, let me know, and I can connect you guys with questions later on. Otherwise, have a great day. Love yourself.
Take care.